Welcome to Hello City. Yet another episode will bring you another talent from Mediclinic. Today I have amazing physicians here with me. I have one of the stars here. We have one of the most amazing breast radiologists here in Mediclinic. Dr. Alex, could you please introduce yourself?
Thank you for the very flattering words. I'm a South African board-certified breast radiologist. I have close on 20 years experience with dedicated breast imaging. And I have the proud claim to fame that I came to Dubai to set up one of the first dedicated breast imaging practices 15, 16 years ago.
Wow, that's amazing. And Dr. Annett, one of the best breast surgeon in Mediclinic. Could you please introduce yourself?
Yes, I will. Thank you so much for the invitation and for the flattering words. That's too much for me. I get red now, but I have the pleasure to work with Alex for a very long time. So I joined Mediclinic in 2008 and Alex was already here setting up the unit. I'm German trained in general surgery and then specified this more and went to training in Switzerland and came back and have done breast surgery ever since.
Excellent. And now, correct me if I'm wrong, you ladies knew each other for 15 years and worked with each other for 15
And we
years?
still like each other. It's amazing.
Amazing,
Still a
right?
good team.
Still enough. Still a good team.
That is amazing. And you guys are an amazing team, amazing, comprehensive team. So, Annette, my question is for you. Can you please just give us an overview of the importance of early detection and screening for breast cancer?
That's a very good question. And we like to do a lot of screening, Alex and myself and the whole team. So the earlier we find breast cancer, the better is the chance of healing, the better is the chance for survival, the lesser is the treatment as well. That means hopefully there's no need for chemotherapy and all the other modern drugs. Our surgeries are definitely smaller, nicer, easier recoveries, and we do not do these big, massive surgeries that we used to do 20 years ago.
Excellent, excellent. And Dr. Alex, this is a question for you. Could you shed the light on the role of radiology, like mammography and ultrasound in the detection of cancer?
Sure. So we use mammograms, ultrasounds, and MRI. Let's not forget that. Basically, mammogram is the gold standard for breast cancer screening and for diagnosing breast cancers. Basically, mammogram is an X-ray of the breast. It allows us to look inside the breast. And it allows us to really actually compare. I think God always luckily gave us two, so we've got a good comparison. And it allows us to compare what's normal breast tissue and what's abnormal breast tissue. We use ultrasound, which is a sound-based study, to further help. It's a supplementary exam. And then MRI, which is almost a blood-based study, which allows us to further characterize lesions that we can see. In patients who have absolutely no problem at all and who are very young but who have a high risk, we would only use ultrasound and MRI, excuse me. But if it comes to somebody who's over the age of 35, 40, we would consider doing a mammogram first. That is really the only best screening test we would do.
Excellent, excellent. It is Pink October. So I wanted to ask you, Annette, if you remember of any story that got diagnosed and treated during Pink October. Do you remember any?
Pink October is one of my favorites, even though that I don't wear the pink. But in October, even though that you are my boss, I don't work that much. I go around and talk a lot. Awareness, early detection, whatever we do here to find breast cancer early. And I want to tell you a different story that I went with one of my patients into a school, and it's always very exciting. You have all these kids. I have kids on my own. And you go with someone who had cancer, and it's very emotional. Most of the time, it's a school that their kids are in, and then they stand in front of, 900 kids were there, and it was like, wow. And she said, okay, I had cancer. Look at me. I'm fine. I'm good now. And she asked the kids a question, do you know someone who had cancer, who has cancer? It could be family, friends, or whatever. And I can tell you that maybe 70%, 75% of the kids raised their arms.
Wow.
That's incredible. I mean, everybody can have cancer. And even these kids know, they're young, they're in the college, they're 12 to 17. They all know someone who had cancer, and it's very difficult to deal with that.
Dr. Alex, what are your thoughts about breast cancer screening?
So we have to remember that breast cancer screening should be for asymptomatic women. It's not for women who feel problems, who are aware of lumps, who have symptoms. These are women who have absolutely no problem. and who should be attending because they qualify in terms of age. We qualify because we get older and we are female.
Mhm.
The problem is there's a trend towards younger cancer now. So we're now wanting to educate younger women who are asymptomatic to understand what the symptoms are of breast cancer and have a reality check, actually, that you don't need a family history to be a candidate for getting breast cancer. In fact, 75% of us now don't have a family history and present.
Astonishing.
It is, it's
Astonishing.
frightening.
Yeah.
And so I think if we can all understand, it's not, oh, a woman over 40 needs to be aware that she needs to be screened.
Right.
It's an awareness that women need to understand. We've got breasts, men too, they're not immune. We've got breasts and we need to look after them. And
Right.
what does that mean? Well, it means that if you don't have a symptom, it's not that you're off the hook.
Right.
It means that you've just got to be aware of where you can go and what you can do to make sure you're fine.
Right.
Bottom line.
Right. Perfect. Dr. Annett, how do you think social media played a role in raising the awareness during the Pink October month?
I'm an elephant with the social media, so most of my generation might be, but I see with the kids and the generations that they are constantly on something and there are always news coming in. I think one, you have to be careful what you're looking at, that you know the content very well. And number two, we of course all use it to spread news, new things, new technologies, innovation in the treatment of cancer, and even awareness. We see it, our patients are using it, they post their stories that they are well after treatment, they post the good stuff, they post the bad stuff. And at the end, I think we all as consumers have to decide what are we taking there, how do we digest the information that we see, but it helps a lot in times like Pink October to raise awareness on events, on information, on what you can do to help as well. So we like it and we have to be careful. I think that's the message I wanted.
Dr. Alex, could you shed light on the latest and the greatest in breast imaging?
Okay, I mean, the good thing about breast imaging is that it continues to advance all the time. We are a far way away from the traditional black and white pictures, actually blue, light blue pictures. I don't know if you remember those, Annette, maybe before your time. But basically, the biggest changes that we have now, we see in mammography. Mammography has developed a 3D aspect to it. So before we used to just compress the breast in 2 views, and we were lucky if we could see something on that. And we had many recalls because we weren't sure if we could see a lesion or not.
Right.
Now with 3D, it's the ability to actually slice the breast like a loaf of bread with slices, and we can peel those slices back and look inside and see if we actually identify anything. The good news about that is that you can pick up cancers much earlier, little distortions that we routinely wouldn't have seen. And we can also negate things that we originally would have thought, they look like a problem, and now we look and we say, oh, it's not a problem. They don't need to worry about it.
I see.
So it's a very good thing because it's very sensitive to pick up an abnormality which we routinely may have missed before. But it's also good enough to say it's not a problem and that's not something we need to worry about. Mammography has also developed a contrast aspect to it now. So we can now inject a patient with contrast and have a look and see what the blood is doing inside the breast on a mammogram, which is amazing. And this also gives us an opportunity in very dense breasts to see if there's something hidden there. Routinely, we'd have to send those patients to an MRI, and maybe somebody can't fit into an MRI, or they are claustrophobic, or they've got metal implants. Now, a contrast mammogram will take care of that, and that's really super. So that's great when the surgeons can refer that patient to us. And then under ultrasound purposes, we've got elastography, which allows us to see if a lesion is very hard or very soft. Cancers are traditionally hard, so they're not going to bounce. And so our elastography is going to already tell us this lesion looks like it's a problem, should get a biopsy. So that's really great. And then let's not forget breast MRI again.
Of course.
And breast MRI traditionally is a 45-minute long investigation. And it's nasty because you're lying on your tummy and you're in an uncomfortable position and you can't move for 45 minutes. Now, thankfully, for screening purposes, we can do something called an abbreviated MRI, and we're hoping to get this introduced within time to be able to do here. That study is now 12 minutes. And so that's something that's much more palatable to a patient who hasn't got a problem and who will be able to just end up having that procedure done fairly quickly with almost as good sensitivity as a full MRI.
Amazing, amazing advancement. Dr. Annett, could you correct some of the misconceptions that most people think of during October, Pink October?
I mean, risk factors for breast cancer. We sometimes have this still in questions when we go out or when people are coming, moms are asking for it, like wearing a bra with a wire or the color of the bra. It doesn't make any difference, neither the deodorant and these things. But I think the most important is what Alex already mentioned, that family history, or I don't have anybody who had breast cancer in my family, so I'm actually off the hook. No, it's not true. Only 5 to 10% of the breast cancers we see and are diagnosed are due to hereditary problems or familiar problems. The majority of us who gets breast cancer is just random. So we are all on risk. And unfortunately, even we see a lot of more younger women having breast cancer here.
I see. Excellent. Excellent. And Dr. Alex, the last question. Breast health is a year-round concern, but Pink October puts a spotlight on the cause. What message would you like to share with our listeners to let them prioritize regular breast screening?
Love yourself enough to care. Bottom line, who wants to die of a disease we don't need to die of? If you are diagnosed in the early stages, a stage 1 or a stage 2 breast cancer, that means possibly you haven't even felt it, or it's so small that it yet hasn't reached your lymph nodes. You've got a 90 to 99% 5-year survival, which translates to almost a 30-year survival of over 90% as well. A stage 3 goes to 66%, and a stage 4, which is in the lymph nodes and anywhere else in the body, is now 31%. So why would you not give yourself the benefit of the doubt and get yourself checked for something that might really be the best thing that you can do for yourself? I always say to my patients, think of Valentine's Day or your birthday and gift yourself. Gift yourself a mammogram.
Wow.
Okay, I mean, really, why not? That's the best thing that you can do for yourself.
I am going to do that.
Thank you.
This is an amazing, amazing message. So love yourself, ladies. This has been such an inspiring podcast. I think it will reach out to many, many people that's going to benefit from this. Thank you so much, doctors.
Total pleasure.
Thank you very
You
much.
guys
for
are
inviting us.
amazing.
It's nice.
Until next time, stay tuned.